Ma'am, Zeenat, ma'am.
Shall I start? Okay, I'm here, ma. Bismillah Rahman Rahim. Assalamu alaikum and very good evening to all. On behalf of the management, staff, and students of the Department of Commerce, I welcome you all to the international webinar on Stay Safe, Stay Healthy. The resource person of the day is Dr. Chandrasekhar Padmaraju. If you have a positive attitude and constantly strive to give your best effort, eventually you will overcome your immediate problems and find you are ready for greater challenges. All good things start with prayers. May I request Dr. Fahmida Yasmin, Assistant Professor, to recite few verses from Holy Quran.
Assalamu alaikum. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. صدق الله العلي العظيم. Translation: does not burden Allah any soul except to its capacity. For it what it earned, and against it what it earned. Our Lord, do not take us to task if we forget or we err. Our Lord, do not lay upon us a burden like that which you laid on those who were before us. Our Lord, do not lay on us what not the strength we have to bear it, and pardon us and forgive us and have mercy on us. You are our protector, so help us against the people disbelievers. Surah Al-Baqarah, verse number 286. Allah has spoken the truth.
Jazakallahu khair and thank you, ma'am. I quote, we are and will be going through the most radical transformations the world has ever seen. People are just terrified, excited, depressed, heartbroken, and hopeful all at once. I unquote. Now, I request Mrs. Shakila Begum, Assistant Professor, to render welcome address.
Thank you, Zeenat. More than a year into pandemic, and we are still learning how to fight COVID-19. COVID pandemic and lockdown has brought about a sense of fear and anxiety along the globe. Though human civilizations are facing threat for their survival and livelihood, life still has to go. In sight of this, it is a sincere effort instigated by Department of Commerce, Justice Bashir Ahmed Sayer College for Women, to create awareness about how to resolve the pandemic and be healthy. I deem it as a privilege to welcome you all who are present virtually. I extend my warm welcome to resource person of the day, Dr. Chandrasekhar Padmaraju, MD, General Cardiologist at BMC, Manchester. Chandrasekhar has completed his medical school at Gandhi Medical College, Secunderabad, India in the year 2001 and has done his master's in public health in the University of Carolina. He is currently working as a general cardiologist at the BMC Manchester after serving as hospitalist in cardiology section at Dartmouth Hitchcock Medical Center, Lebanon, and has also served as faculty IM hospitalist at Province Sacred Heart Medical Center, Spokane. Dr. Chandrasekhar has an excellent experience in teaching the medical residents and the medical students at the various colleges. He has also served as a member of diabetics, pharmacy, and therapeutics committees cohort leader of the hospital's team, and also a member of Rapid Response Team Committee during residency at the Mount Vernon Hospital. Sir has been awarded the Best Intern Award for the year 2004-5. To add further to his achievements, Dr. Chandrasekhar has a rich profile in volunteer experience. He has participated in flu shot program in the Mount Vernon Hospital in December 2006, where he was involved in screening patients for indication and contradictions to receive flu vaccine. He has attended clinics at the Fishkill Correctional Facility, Beacon, New York, where he evaluated and treated patients with various respiratory complaints. He also has to his credit many research publications in various journals of reputation. We welcome you once again, sir.
Thank you, ma'am. I quote, few things in the world are more powerful than a positive push, a smile, a word of optimism and hope. You can do it when things are tough, I unquote. Now, I invite the chief guest to enlighten us on how to be safe and healthy, which is the need of the hour. Sir, now the stage is yours.
Thank you very much for a wonderful welcome and introduction. I'm honored to be here today and speak in front of all the staff. So, respected principal, vice principal, and respected staff of JBS College, dear students, I'm definitely honored to be here today and speaking in front of you about the crisis that we have been going through, which is COVID-19 pandemic. So I'll try not to get into the deep scientific details, but we'll try to talk like what are the most important things that we all can do and how to protect yourself and others, like our beloved members of the family and ensure the society. All right. All right. Can you hear me? Can you see the screen?
Yes, sir. Yes, sir.
Sir.
Oh,
Yes, sir.
okay. Just making sure. Okay, so the topic that was assigned to me was stay safe and stay healthy. So we'll try to focus, as applicable to the topic, more on prevention. But however, we like to, most of you knows what's going on around the world. And most of you know a lot of the stuff that I'm going to talk about today about the COVID-19. But let's touch upon some things. All right. So who is at risk of this disease, COVID-19, right? So everyone, right? Everyone. So it does not discriminate against gender, age, anything. So everyone is at risk. But most importantly, who is at risk of getting severe disease, like severe illness? So we all know that most of the comorbid conditions we also refer to as diabetes, obesity, and people who are immunocompromised. What do I mean by immunocompromised? So immunocompromised means people with weakened immunity for various reasons. And one amongst them, to just have an idea, is the most important one is people who are going through chemotherapy, meaning getting treatment for various cancers. So people who are undergoing chemotherapy or receiving drugs for cancer, so what it does is it does weaken their immunity, that the therapy. So that means they are susceptible for the virus, which means the virus can be more serious or cause effects and serious illness in those patients. So it is important, if at all, if there are any people who are undergoing this therapy, to be extra careful. That's what I would say. I would emphasize again. So they need to be really careful. All right. So, and people with a debility, meaning like elder people with a little frailty, with some other comorbidities, or whose functional status is kind of on the lower side. So whose functional status is not as good as like a normal adult person. So they're also at risk of developing serious illness. So the COVID-19, as most of you might know already, it stands for coronavirus disease 2019, because this is a virus that we have not known before December of 2019. And the reports from the international journals and everyone knows that it has originated in China. So CO, the first two letters CO, like represent corona, VI for virus, and D for disease. So just in case, just for the informational purposes, that's what COVID-19 means. And it is caused by a virus called SARS-CoV-2, which means severe acute respiratory syndrome, coronavirus 2. So this is a novel virus. So when it first surfaced, people used to refer to it as a novel coronavirus. So and then renamed it as SARS-CoV-2. Now let's talk about what are the symptoms, or how does it present in case if anyone gets infected. So the manifestations of COVID disease range from mild illness to severe illness. It's a presentation is usually wide. Majority of the patients will have only mild symptoms. So what are those symptoms? Fever, chills, cough, fatigue, muscular body aches, headache, new loss of taste or smell, sore throat, congestion, meaning nasal congestion, runny nose, nausea or vomiting or diarrhea. So it can present, as you could see, literally in multiple different ways. Sorry. But so whenever you have any of these symptoms nowadays, so you presume that you have coronavirus unless proven otherwise. So because we are dealing with a pandemic, a crisis in India right now, we are going through in the middle of the crisis, right? We are going through the crisis. So it is important for every one of us to be vigilant. So when I say vigilant, yes, but at the same time, you don't need to get panic. So just be vigilant. If any one of us have these symptoms, what we have to do, the first thing is to isolate. So whenever we have any of these symptoms, just presume that you have coronavirus and isolate yourself. So then when to seek medical help, or when to go to a doctor, or when to talk to doctor. So if you have any of the above symptoms that we just discussed, doesn't mean you have to run to the doctor, or you don't have to get panic, or you don't have to get anxious or stressed out. Most of the symptoms, as I just said, 90 to 99% of the people will recover. I'm sure you have been following the statistics every day in and day out. So it is only 1% of the people that get serious illness requiring hospitalization or treatment. So you don't automatically set into panic mode. That's the first thing I request every one of you to keep in mind. Again, this disease is very, I would say this virus, I don't want to scare or anything, but it is very infectious, very contagious. So let's focus on containing the disease, stop the spread of the disease. How do we do that? So if you have any of these symptoms, you just isolate first and then get tested. So when do we have to get tested? You don't have to be tested right away, because your test is more likely going to be positive after 2 or 3 days, because the incubation period, the time between the virus gets attached to our body, like inside the nasal mucosa, and before the onset of symptoms. So that's called incubation period. So the incubation period is average about anywhere from 2 to 14 days. So once you have any of the symptoms, you don't have to get rushing to the hospital to be tested because sometimes it can be negative. That doesn't mean you don't have the disease. As I said, it takes few days for the symptoms to develop. So you can wait 2 or 3 days, but first thing to do is isolate so that you can protect your beloved family members and others around you. And then make an appointment or get tested in the next day or two. That's fine. Whenever it is like convenient for you, whenever you can do this test safely in a manner where you can go without exposing others, so you can go get tested. All right. So after we talked about this common presentation symptoms, so when do we have to be concerned, or what are the symptoms that one has to look for when you need to go for medical help? So what are the symptoms? So I would say I'll start with trouble breathing or shortness of breath. Let me step back. So yeah, let's finish this. So if any person is having difficulty breathing, so in other words, when they walk around, let's say they isolate themselves, they're walking around, they feel short of breath, meaning they are unable to take deep breath, or they feel like they have to breathe harder. So that's one of the symptoms that you need to consult the doctor. And then oxygen saturation. I'm sure some of us already have bought, like, the oximeters which measure blood oxygen concentration or saturation level. So the normal oxygen concentration is in the blood is anywhere from 94 to 100%. So, but sometimes again, depends on how you check it, how your finger is, depend on the accuracy of the device and the oximeter. You don't have to get panicky if it is 92, because I said the normal is 94 to 100. Usually the organs perfuse very well without any problem with oxygen saturation up to 90%. So I would suggest oxygen saturation less than 90%. That's when we need to be a little concerned, anyone who gets infected with the disease. All right, and then persistent pain or pressure in the chest. So what does that mean? Usually virus does not, so this virus, again, this is a respiratory virus, which means the primary organ where the virus affects is the upper respiratory tract, which includes nose, oropharynx, meaning the throat, and then the lungs. So the primary organ the virus attacks is lungs. That is why most of the symptoms are, as we talked, cough, but with any virus or bacterial infection, that is the body's response in the form of fever and chills. And then shortness of breath, as we said, trouble breathing. So these are all symptoms related to the respiratory system, which includes the lung. So, and then the reason I'm mentioning that is persistent pain or pressure in the chest. That means that is now, this tells us that this is some other organ that's getting affected. So probably heart. But again, I will emphasize, I do not want you to get panic. This is very rare. I think in one of the next slides, I have included that. So when I say persistent pain or pressure in the chest means now there could be a chance that the heart is getting affected. That's why I put this as symptom as one of the things that you should be concerned about and to seek medical care. And then new confusion. So new confusion means people disoriented, we refer to as disoriented, right? They don't know where they are, or slightly the kind of, the orientation to the surroundings. So whenever you have any symptom like that, that's a disorientation, meaning it is affecting the nervous system, meaning the virus is not affecting the nervous system, but just the illness is serious that now it's kind of putting toll on nervous system. That's what I meant to say, brain. All right, the next one is inability to wake or stay awake. Again, something related to the severity. So that means either blood oxygen concentration is low, that people are getting disoriented and getting weak. All right. So I had put in some points here. So how to care just in case if infected, right? So if you have any of those symptoms, go get tested. Let's say if it comes back positive, that means now it is confirmed that yes, you are infected. But again, not every cough or not every shortness of breath is a COVID, but at this time, you have to presume that it is COVID disease unless proven otherwise, meaning after test. The popular RT-PCR test that we've been doing all over the world. So if it is positive, that means yes, it's very like highly specific, meaning if it turns positive, that means you definitely have a disease. If it is negative, that does not mean you do not have a disease. It just means that the test has not detected virus for various reasons. We don't need to get into the details or scientific details. So what I'm trying to say is, if you do have any of the symptoms that we have discussed, and if your test is negative, so that means it is wrong to assume that you do not have a disease. If you have symptoms, any of these symptoms that we discussed, that means it's more likely that you have disease, and it's better to get retested. And don't presume that you do not have a disease unless the retest is negative. All right, so let's say isolate. The first thing, isolation. I re-emphasize isolation. As for the reasons again I mentioned before, the disease, the virus is, as it's been proven, like multiple times more contagious than a common cold. And as we all know, so there have been reading so many articles and news everywhere that the virus has been constantly mutating. And it is not uncommon. Any virus, for its survival, like any other like a living being, it has to mutate in order to survive. That's natural. But that doesn't mean we have to get panic again. These are all little details. But what I'm trying to say is the virus is very contagious. So you have to stop the spread. So isolate, isolate, isolate once you have the disease, so that you do not give disease to your family members or your neighbors or, like in the society. And then do not worry. Don't get panic. Again, I will re-emphasize. If you look at the statistics and the data, so the case fatality rate is only 1%, meaning only 1% out of 100 people infected are actually dying. So that means it is not any dangerous than the viruses that we already know. I take that stance to say that. Do not worry. Case fatality rate is still low, but be careful. And then, so let's say if you are infected, so you isolate yourself, don't worry, you monitor your symptoms. Let's say you have fever. Yeah, check your temperature. All right. So when I say fever, temperature more than 100 is fever. I mean, let's make it easy for everyone to remember. So it's 100. So some people might have they say low grade fever. Yes, but again, it's not just the number. Like, pay attention to your body. See how you feel. If you're feeling like yes, you don't feel well, you feel unwell, and your body tells you that, oh, okay, I'm not myself, then yes, even if your temperature is 99.8, yeah, it is considered a fever. All right, so basically pay attention to your body, monitor symptoms, how, if you are getting better day by day or if you're getting worse. And then definitely consult a doctor. If there are any alarming symptoms, your symptoms are not getting better when you isolate yourself. Let's say if your fever is getting worse, when you walk within your house or outside the house, if you feel like you are short of breath or you're not able to take deep breath, yeah, that means symptoms probably are getting worse. So then consult your family physician or doctor or hospital who you know. And then what other general things that you can do to yourself when you get infected? make sure you are well hydrated, meaning drink plenty of water. Whenever your body is fighting an infection, it's all we have to do is we have to provide optimal environment, meaning optimal, like a systems maintenance for systems, your body to fight the infection. So you have to do every little thing that kind of provides optimal well-being of the immune system, I would say. So one amongst those is hydration. So drink plenty of water. Plenty meaning, let's say if it's summer, for a normal adult, I would recommend 3 liters of water, at least 3 liters. And then optimal diet. So I know a lot of people have a lot of questions and myths about different diets, but so they have done few researches, and we have some articles out there already. So what is the optimal diet means? Most of the research says that diet that incorporates more fruits, vegetables, and whole grain diet is what is recommended across any study to kind of, again, to maintain or to boost your immune system, right? So when your body is trying to fight the virus. So that's the optimal diet. And there are some articles, few articles have recommended to, they basically highlighted the importance of incorporating some vitamins and minerals. Obviously, those are very important. They have mentioned there is some mention of vitamin C, vitamin D, vitamin A, and zinc. So when you eat a lot of fruits and vegetables, you typically get all these minerals and vitamins in your diet. So, and then exercise. When you are caring for yourself at home, if you're infected, yes, get rest, but at the same time, you don't need to be bed bound. But what I'm saying is, yeah, don't get hooked up to the bed. Get up and walk around. Gentle exercise is definitely, like a low level exercise is definitely good for the body. You need to get your muscles active and get your circulation going, because in some patients, and again, like people who are vulnerable for serious illness, so they're probably, you have heard, they develop blood clots. So this is another reason we try every little thing to help improve your well-being or create an environment within your body systems to fight that infection and to prevent the complications. So if you are up and walking around, just even 2 times a day should be good enough, so that your muscles are active, leg muscles are active. Keep stretching your legs, whatever works for you or whatever you like, so that you're not just couch potato. And then rest. So good rest to the body is one of the ingredients to boost your immunity. So good sleep, in other words, at least 7 to 8 hours of sleep is good to boost your immunity system. Right. So I think we have put the slides backwards, a couple of them. So what I meant to say is when to get tested. I think we already talked about it. So when do you get tested? If you have any symptoms that we talked about, yes, that's when you get tested. Or should you get tested even if you don't have symptoms? Yes. So if you think that you are exposed to a person who was COVID positive, yes, that's again one of the situations when you get tested, just to be sure, and also to be sure that you can take care of yourself, and also you can protect yourself and also protect others. Because again, we know a lot of people are, as you know, or you've heard the word, asymptomatic carriers, meaning they have the virus in their system. So they are infected, but they do not have symptoms. So those are the people that we call them as asymptomatic carriers, meaning they do not have symptoms, but they are infected. So if you have any suspicion that you have been exposed to a person with COVID-19 or been around or in close contact, yeah, that's one situation where you need to be tested. But if you have any symptoms, definitely you need to be tested. And then as as we talk about, prevention is the best medicine, right? As we all know that. How do you even prevent getting infected? So these are the five important things in the order that I think is important order. Wear a mask. Always wear a mask. I don't know if we have the caption in India, but here we have the caption. Masks save lives. Masks save lives. That is the one thing that has been proven to save lives, because you you decrease the spread, you curtail the spread. So that means there is a less risk of some vulnerable person to be infected if you wear a mask. So that means you are indirectly preventing the death. So that's how you are saving lives. Wear a mask. Some people suggested a double mask, depending upon what kind of mask you're wearing. So it's not even bad idea to wear double mask if you are especially around people who are strangers to you, who you don't know, or who might be at risk of, or who are at a high risk of having a disease. Yeah, so it's not a bad idea. And then distance. So when I say, let's actually talk about proper technique of wearing a mask. Make sure that you cover your nose and mouth. Make sure it is snug. The mask is snug around your nose and mouth. So that's the proper way to wear mask. Otherwise, it does not serve the purpose. And then distance. So 6 feet or 2 meters is the distance recommended. And I'm sure you know why experts have come up with that number. That's because when you're around people, when they cough or when they talk or when they sneeze, so it is that the droplets, we call it as little droplets that come out, carry the virus, most likely carry that virus. So if you are around that person within that distance, you are likely going to inhale that droplets, and that's how the virus spreads. So that is why social distancing is very important. And then third thing, get vaccinated. So whenever the soonest available, as soon as the vaccine is available to you, get vaccinated. And then fourth thing, avoid crowds or avoid places with much less ventilation. So clearly avoid closed spaces, because that is where the virus spreads very fast, because the droplets tend to stay in the environment longer period of time and more droplets tend to be there. So that is why the crowded places and closed places are much riskier environments to be in. All right, then wash hands, especially before you put your mask or when you adjust your mask, you wash your hands right before and after, because you don't want to get that droplets which likely has virus in close to your nose or mouth. All right. So I think we also talked about RT-PCR, which is highly specific, but not very sensitive. Again, we don't have a clear data. Again, let's not get into the details, but what was, just to reemphasize, if you do not, or if your test comes negative, that means that the test has not detected virus. Doesn't mean if you have symptoms, especially does not mean you do not have disease. So you're more likely to have disease than not if your RT-PCR is negative when you have the symptoms that we talked about. So get retested. But again, when we use the word highly specific, meaning if the test comes back positive, it is very much likely that you have the virus and disease. So that's what it means. All right. And then I know, look, I'm a cardiologist. Obviously, I need to talk about what are the cardiac effects of the COVID-19. So let me start with it is infrequent, very infrequent, very infrequent. Again, I'm sure you kind of, learn like watching the news or, reading somewhere that, yeah, such and such person had heart-related condition. That does not mean that it was the COVID-19 which caused the like a cardiac or heart effect. Because people can have, when let's say some people are infected with COVID-19, does not mean that they do not have other problems. They might have coexisting problems. They can have coexisting problems. So we cannot establish that causal effect relation or presume. So I'm trying to say that put it out just to be sure that you don't need to get panic. So if you get COVID-19, oh yeah, my heart is going to be affected. My like kidneys are going to be affected. No, there is no such thing like that. It's only in severe illness because of the cascade. One thing leads to the other. So there is a chance that when they get into septic or severe illness, it's definitely there is a risk for multi-organ damage. Again, it's extremely rare. So the cardiac effects from COVID-19 is very infrequent. I can actually tell you the numbers. So when I was researching, I found that like people, okay, let's step back. Any viral infection is a stress on the body. So when not just that it's COVID-19, but even people who have had common flu or influenza in the past, or any viral respiratory infections, I have seen patients myself. So it is rare, but it can happen that it does affect the heart because it's just stress. So sometimes stress can lead to what's called myocardial infarction, in other words, heart attack. More often than not, it tends to be mild. So it's like a mild heart attack, meaning mild damage or injury to the heart muscle. Doesn't mean, again, it's not a serious problem. It's not actual heart attack that is caused by a different mechanism, like people who have diabetes or who have high cholesterol levels. So there are different mechanisms how a person can have a heart attack. But usually the heart attack that is caused by infection with COVID or any viral infection or any other infection like a pneumonia. So that's a different mechanism, and usually it tends to be mild. Having said that, there have been some case reports where it does cause the inflammation of the heart muscle, the virus. Not only it affects the respiratory system, including lungs, but it does affect heart. The same inflammation can affect the heart inflammation. That's the term myocarditis, meaning the heart muscle is inflamed. So and muscle gets weaker, the heart muscle gets weaker, and then they develop what's called heart failure. But again, that's very infrequent, very infrequent. But again, I mention it again. So when I did that research, actually some of the studies, but again, it is a registry data. We don't have controls like a case control. People who have had, like, let's say, influenza in the past. So they have so much data because the flu has been there for several, like, decades. So based on that data, about 10% of the people have had some kind of heart involvement when they had influenza infection. To just give you a perspective, meaning it's been around. Any viral infection, or for that matter, any bacterial infection can affect the heart. So it's not that COVID-19 is like only virus that is affecting the heart. No, it's been around. In fact, I was surprised to see those numbers that I know with data from COVID-19 so far, we are still learning so much about it. We don't have enough data. I'm not comparing, but at least so far, this is not anymore causing any more incidental heart effects compared to the previous viruses that we already know. So I don't think it's a big issue. It's very infrequent. And then I think I talked about pretty much the common and practical aspects of coronavirus and COVID-19 disease. So I don't know how much time we have. So now I think we can open for questions.
I request the participants to post your questions.
You can ask.
Can we ask our questions?
Yes, sir, proceed.
Yeah, sure. Please go ahead.
Yeah. First of all, thank you very much for coming forward and explaining us on COVID-19. It was very informative session, sir. So I have a couple of questions.
Sure.
One is on the vaccine. Actually, if a person has taken first dose of vaccine, right? They say like if it is a Covaxin, after 4 to 6 weeks, maybe in between 4 to 6 weeks, they have to take second dose, and if it is a Covishield, they say like 6 to 8 weeks. But after 4 weeks, if that person gets affected with virus, and if maybe after that it takes maybe a couple of weeks to get recovered. By the time if that 6 weeks gets passed, can he take vaccine immediately, or he need to wait for some time and take the vaccine of second dose?
Okay, yeah, it's a good question. So the question is, can you get second dose, either Covaxin or Covishield, if you are infected or been tested positive in between? Is that the question?
Correct. After taking the first dose, correct.
Yes. So I don't think there is any like a real contraindication to taking vaccine unless people with like a severe severely immunocompromised for the what we discussed about people who are undergoing cancer treatment or who have some autoimmune disease. Other than those people, as far as I know, yes, you still can take the vaccine, yes, because the natural immunity has not been proven to be, or we don't have enough data how long the immunity that you get from a natural infection lasts, or how much of it is actually effective. We don't know. Most likely, yes, but it is not a contraindication like getting COVID-19 or getting tested positive for COVID-19 between the 2 doses is not a contraindication to take your second dose. As long as you're feeling well, you're not, in other words, let me rephrase that. If you're not having any serious problem or serious illness, only have mild symptoms, it is okay to take the second dose.
Okay, sir. Yeah, that answers my question. Thank you very much. One more question.
Sure.
If a person has any medical history, kind of cancer or whatever you explained, and currently also if that person is suffering with that, and he is having some kind of side effects, like maybe some motions or whatever it is, can that person take the vaccine?
Yes. But again, so if a person is severely ill, meaning in a position where the patient needs to be in the hospital, yeah, that is one condition that I would say, yeah, don't consult your doctor to be sure that, because I do not know the exact indications and contraindications of both Covaxin and Covishield, like subtleties, I don't know, but I have listened to the experts. Again, myself, I'm a cardiologist. I'm not a virologist or like a infectious disease specialist. But as far as I know, if you personally are not sick enough to be hospitalized, I think you can take vaccine. Like I think you have mentioned diarrhea or like a mild headache, things like that, or cough. I think those symptoms or those manifestations from whatever it is not a contraindication to take the vaccine.
Okay. If anyone is taking any steroids or anything, they also can go for vaccine?
No. Steroids are there. They suppress the immunity. So if a person is taking steroids, then definitely they have to consult their physician or doctor before going for the vaccine. And again, it depends on the dose and the details. So I cannot be specific for those questions. But yes, steroids are the medications that we typically give to suppress the person's immunity for various reasons, or given the conditions. So I don't think it is a good idea to take vaccine when you are taking steroids. But again, I don't want to make that blanket statement because I cannot give the specifics without knowing the like a medical history. But if any person is taking steroids, I can tell that they definitely have to consult their local doctor before going for the vaccine.
Thank you very much. These are my questions.
Yeah, okay.
Any other questions?
Sir, I want to ask one question, sir. Shall I ask?
Sure.
There are questions in the chat box.
Oh. What is sorry?
Hello?
Can you repeat? Yeah, can you repeat the question?
Yeah, the question is how to tackle the social stigma attached to this COVID-19, sir.
All right. Yeah, that's a good question. It's not the first time, unfortunately. We Indians are thinking in the society where, we have been plagued with a lot of stigma with medical. That is another reason, I would say that's the main reason why people hesitate to seek medical care. Unfortunately, that's one wrong thing. So how to tackle that? Yeah, how to tackle that? That's a good question. I think it's like a creating awareness and building self-confidence. Be informed, I would say. So let's say, for example, people who know about what this means to them, what this means to their family, right? So once you are well informed about this is not like a something that it's a virus. It's not something that you are doing or that you do will spread the disease. It's a virus. It behaves its own way. So if you are well informed, if you are confident about what you're doing, I don't think you have to care about what other people think. I know that's the stigma. That's the stigma. But the one main thing that I would advise to deal with the stigma is well educated, be informed, like learn yourself. I think that's one way that you can deal with the stigma. I can't think of other things. I think it's just like building self-confidence. How do you build self-confidence? Be informed, learn about it, and be able to speak up. So yeah, you care about your family. You are actually caring about your society, in other words. So you are doing good for the society. So you don't need to be the victim of the stigma. So I think you have to speak up.
Thank you, sir.
Good evening, sir. That was a very nice presentation. I have a question.
Sure, go
Uh,
ahead.
like, if a patient has got comorbidities and he or she doesn't have any symptoms, they are asymptomatic, then
Mhm.
can we take care of them at the home, or do they actually need hospitalization?
That's a very good question. Yes, I thought someone would ask that question, so I have not put in a slide actually. So I'm glad you asked this question. So the question for the audience, the question is, she's asking if you're tested positive and if you do not have symptoms, can you stay home? And is there a need for hospitalization? Absolutely no. You're right. As I said, if you just look at the simple numbers, if you look at, I think in the Indian, the website, the Ministry of Health and Human Welfare, the website, it kind of posts like a recovery rates, which is a good thing. So not everyone who is infected will get sick for the same thing that I talked about in the beginning. It's only 1% of the people, maybe close to 5% of the people require hospitalization, and 1% is like a serious illness and death. Maybe 2%, I don't know, but 60 to 70% of the patients, again, it's a rough guesstimate, can be managed at home without requiring hospitalization. But the things to be, I emphasize again, the things that you need to watch or monitor yourself when you are caring for yourself at home is like, okay, how are your symptoms? Monitor your symptoms. How are you feeling? As I said, the important symptom to be concerned about is shortness of breath, because that means the person's lung is getting affected. So, and what is the sign of it? If the person's lung is getting like more and more of lung tissue is getting affected, that means their oxygen saturation goes down. So that's another thing. When I say monitor, yes, check your temperature every day. Like walk around and see how you feel. Are you feeling more short of breath than yesterday? Or are you feeling more breathlessness than yesterday? And if you have that, check your oxygen saturation. And if your oxygen saturation is above 90, I think you still can be managed at home. If it's less than 90, yeah, definitely consult the doctor. There is no hard and fast rule again. Again, if your oxygen saturation it was 95 yesterday, and if it is 92 today, when you check more than once, yes, that is a concern. That means your oxygen saturation, even though it is still above 90, but it's coming down. So that is a concern. Talk to your doctor. Yes, call the hospital and find out if they need to come in. But certainly, yes, majority of the patients who are infected, who do not have symptoms, all they have to do is like look for if they develop any symptoms in the next 2-3 days. And as I said, once you turn positive, you can develop symptoms between day 0 to any time until 10-14 days. You don't know. So that's why you stay home, isolated, keep monitoring. If you develop symptoms, then monitor your symptoms if they're getting worse. If they're stable, yes, take these simple precautions that we talked about. And if the symptoms are getting worse, or if you're concerned, but concerned for a reason, there is no role, or there is no like a role here for any panicness. Just use your judgment. If you're having symptoms and if you see any sign of what we talked, the serious concerns, when you need to seek medical care, then talk to the doctor and get admitted. Yes, if they say so, yes. Otherwise, but absolutely, majority of the patients can be managed at home without requiring admission. I'm sure they have different criteria for admission to different hospitals, but the main thing is shortness of breath, that's a symptom, and oxygen saturation.
Okay, so even a diabetic or a patient suffering from heart ailment who doesn't have any symptoms but is tested positive can be cared at home.
Oh, definitely, yes, can be catered. So regardless of their underlying comorbid conditions, only thing is if any person has comorbid conditions, they need to be a little more extra careful. So I would say if they're consistently having fever, if they are short of breath, yes, so it can still be managed at home. Stay at home, but little be careful. Like go to the hospital or consult a doctor with even slight suspicion if they have comorbid conditions. But if their oxygen saturation is more than 92%, if they don't have significant fever, if they have a fever, it's okay. If they're feeling all right, if they're not too weak, if their blood pressure is okay, if they're not feeling dizzy, yes, they can be managed at home, sure, just like any other person. It's just that once the symptoms or signs of disease spreading in them or getting serious is like a quickly worsening shortness of breath or breathlessness and oxygen saturation going down. So those are the two important things to look for. And of course, they have severe diarrhea, they can get dehydrated quickly and their blood pressure can drop. So if they are feeling dizzy or lightheaded, Yeah, those are the things that, yeah, you have to consult the doctor right away.
Yeah, thank you, doctor.
You're welcome. Any other questions?
Sir, here is a question. There is a question from me. If
Okay.
we take all precautionary measures in order to protect us from COVID-19, everything, almost all of us have the awareness how to protect us. But how long will it go? So when will we return to our normal life? Is the medical fraternity working on to reduce the spread of this virus, to reduce the the power of this virus? If they are working on it, then we will be successful.
So that's a very good question and beyond the scope of my expertise. Clearly, it's different. Yeah, it's beyond the scope of my expertise specialty. Uh, that's a good question. So as we talked, it's my simple, like, based on my like a medical knowledge. So it's a virus. So it's going to stay there. Yeah, let's not have false hopes, but at the same time, I'm not being pessimistic. We can all together, like all of us, we are in this like crisis. We can win this situation, but what is the time frame? I don't think anyone has an answer as far as I know. But the second part of your question, to answer your second part of the question, is medical community doing anything to kind of curb this virus, or are they developing any medicines or anything to deactivate or make it more or make it less virulent? Is that your question? I think that's your question, right? Hello?
Yes, sir, that's what my question. How long?
Oh, okay. So that's a question. Yeah, I do not think, well, I can say the treatment that's only so far approved treatment is remdesivir. But how do we contain the virus? It's a vaccine. It's a vaccine. And when like so many people in the like communities are vaccinated, and we develop the herd immunity, and then it will at some point be like another common cold or influenza virus. But I don't know when that's going to be the case. I don't know when we'll come to that normalcy, like what we were like in the 2019. I don't know.
Okay, sir. Thank you.
Thank you, doctor. Thank you. That was a very crystal clear explanation on prevention of COVID-19. And you touched upon who are at risk of disease of COVID-19 and SARS coronavirus 2 and its symptoms, and we need to be vigilant, need not to be panic. I think this will be our takeaway of this webinar, and when to seek medical aid or help, and how to be care if infected, and when to get tested, and prevention on COVID-19 and cardiac effects on COVID-19. So very crystal clear explanation, sir. That was indeed a great source of learning and excellent presentation, sir, on stay safe and stay healthy. That is imperative as a need of the hour for every one of us during this pandemic, sir. Thank you, sir.
Yeah, yeah. Again, my pleasure to be here again. Yeah, we can fight this and we can come out of this situation with good success, I would say. So we all have a role to play in this, and thank you for arranging this to spread the word. So again, no need to get panicked. So a lot of us, I mean, human body has amazing ability to kind of react to these situations. All we have to do is provide our bodies with like a good environment so we can fight if at all we are infected, or to prevent from getting infected or being infected. So please take those 5 important measures, and we will hopefully be in a normal situation and normal world maybe soon, sooner than later.
Yes, sir, definitely.
Hello, doctor. Good morning. Before you sign off, one last question.
Sure.
So, patients with rheumatoid arthritis, can they go for a vaccine? If so, what are the precautions they have to take?
That's a good question. So rheumatoid arthritis come under a category of what's called autoimmune disease, meaning the body is producing antibodies against the person's own tissues or organs. So it comes down to what are the treatments or the medications the patient is on. So if the patient is taking high dose of prednisone, I would say to consult the medical doctor locally, because it again depends on their prednisone dose and how long they have been taking, and if they have any like other conditions that they need to consider. So I cannot give specific answer on that. Definitely consult your like a treating rheumatologist or general physician to see if it is okay to take the vaccine.
Sure. Yeah. Thank you.
Yes, sir. Zinat ma'am?
Yes, sir. Thank you, sir, for enlightening us on how to be safe and healthy in this pandemic. Now, I request Dr. Selvi, Assistant Professor, to propose vote of thanks.
Thank you, ma'am. It's not happiness that brings us gratitude. It's gratitude that brings us happiness. I deem it a pride and privilege to propose vote of thanks. On behalf of the Jbas College for Women, Department of Commerce, I am honored to thank the gathering. I place my sincere thanks to our eminent resource person, Dr. Chandrasekhar Patmaraju, cardiologist, for giving his kind concern to address our staff and students on the topic stay safe, stay healthy. Thank you very much for sharing your wisdom of thoughts and value information on being well and healthy, sir. Thank you very much for making your benign presence despite of your busy schedule. Thank you, sir. I express my gratitude to our respected principal ma'am, Mrs. Shanaz Ahmed, our vice principal ma'am, and our management for their continued support in conducting this international webinar. I render my special thanks to our head of the department, Mrs. Hamidunisa ma'am, for her continued support and encouragement. I also extend my thanks to our colleagues for their coordination. Finally, I thank our wonderful participants for their active participation. Thank you all. Once again, thank you, sir.
You're welcome.
Give a round of applause to our doctor.
Thank you very much. Thank you very much for your presence.
Thank you, Dr. Selvi.
Thank you, everyone, and stay safe.
Thank you, sir. Thank you, sir.
You're welcome.
Thank you very much, Dr. Raju. Thank you very much for your grand presence. It's so fine.
Thank you very much for everyone. Can leave the meeting. Participants can leave the meeting. I think feedback form is given in the chat box. You can fill the feedback link. Yes, ma'am. Can we leave the meeting, ma'am?
Thank you, Selvi.
Thank you, ma'am.
Okay, thank you.
Thank you all.